All right, so we're going to get started. Let me check the outside real quick. We're going to get started, guys. Okay. Thank you, everybody, for being here. My name is Naomi Inglar. I work for the Tulane Center of Excellence in Maternal and Child Health, as well as the Tulane Prevention Research Center, two of the three sponsors of today's seminar. The third one is the Tulane Society of Young Black Public Health Professionals, so we want to thank all of our sponsors for today. So this is the third and final seminar for the semester in the Spring 2017 Health, Racism, and Communication Seminar Series. We'll have another series in the fall, so stay tuned. And if you have any suggestions for speakers, please let us know. We're always interested in hearing from our audience about suggested topics and speakers. And let's see. Also, coming up, please make sure to sign in and take an evaluation form. These are important for us in order to track attendance and outputs and make sure that we are addressing the topics and issues and learning objectives that you guys want to address. I will make an announcement that our next seminar for the Tulane Center of Excellence in Maternal and Child Health is called Get Linked In. As you can imagine, it's about LinkedIn and using it as a tool for not only professional development, but personal development and career advancement and all those things that I'm sure all you overachievers are looking to do. And that is Tuesday, March 14th from 12 to 12:45 in Tidewater 1206, so across the hall. And I want to introduce our two speakers today from the New Orleans Health Department Blueprint for Safety program, Nelle Noble and Amy Jackson. So please help me welcome our two guests today.
Sure, so I'll just give a little bit of background about myself. I went to Sewanee, the University of the South for undergrad, and then came to Tulane for public health and social work, the dual degree. I'm a licensed clinical social worker, and I've been pretty much working in the DV field since I graduated, so about 4 years. All right.
Okay. Can you guys hear me? Okay. Well, first off, my name's Nelle Noble, so if you guys can just text this number, like get out your phones and text 22333, or text Nelle Noble 184 to 22333. It'll make sense in a few slides. So my name's Nelle Noble. I'm a clinical social worker and a lawyer. I also did the dual degree at Tulane. I'm originally from Georgia, and I went to the University of Georgia for undergrad. And since finishing graduate school here in New Orleans, I've pretty much been working in the criminal justice field in some form or fashion, and have been at the health department for about a year. And I work on domestic violence and sexual assault programs. So we'll get started. So we are the Blueprint for Safety. Just a little background on the health department. Our mission statement is to protect, promote, and improve the health of all where we live, learn, work, and play. And our vision statement is building a healthy New Orleans through equitable social and environmental conditions and through policies, programs, and partnerships that promote health. Gotta get my notes here. Sorry. Okay. So we have a few initiatives at the health department that address family violence. We view violence as a public health issue, of course, and the Blueprint is part of our domestic violence and sexual assault programming. And so some of the other initiatives we have are DBAC, the first one, which is a multidisciplinary community meeting of practitioners who work in the DV field. So it's a multidisciplinary group. It's people on all different sides of this issue that come together, and we meet monthly, and it's an open group. So we also have the sexual assault response team, which is a little bit newer, but it's very similar to DBAC. We've traditionally focused in the last 2 years on assisting the criminal justice response to sexual assault, but now we're kind of moving more towards prevention and more work with community partners. So we also do domestic violence screening at our WIC clinics, and we are over Harmony House, which is a supervised visitation and safe exchange center run by the local nonprofit Kingsley House. So just a little trigger warning. So most of what we're going to talk about today is going to be just really foundational about the Blueprint for Safety and how we developed our policies, but we're also going to be, talking about domestic violence, and we're going to watch one video in particular that I found kind of harrowing. So, it might be uncomfortable for you to watch, and everybody is affected by these issues in their own way. So if you feel like you want to take a break or you're just done, feel free to leave. And if, Amy and I are both social workers and we think about this stuff all day. So if you want to talk about anything afterwards, just feel free to talk to us. So, okay. So this is the activity. So we're going to do a live poll. So everybody get your phone out and text that number again, what you think of when you think about domestic violence. So we put a couple up there. We'll just do take 20 seconds or so. There we go. Is it working? Cool, okay. This is kind of an experiment, if you can tell. Oh, wow. That's awesome. Okay, cool. I don't know when to stop it. This is so awesome. Okay, we'll keep going. But basically, we just kind of want to get people to get thinking about what is domestic violence. It's kind of a basic thing, but it's important to remember that it really is more than just physical. In Louisiana, legally, we think about domestic violence as any violence in the home between people that live together. So it can be mother, daughter, brother, anything like that. But today, when we're talking and when we talk about the Blueprint for Safety, we're talking about intimate partner violence. So people in dating relationships or married, okay? So this is the video. So this is an actual NOPD training video. This is something they play. So it's dated, you're going to be able to tell that, and it's not perfect at all, and we can probably debrief about this later, but just when you watch it, keep in mind how nuanced our law enforcement response to domestic violence has to be. There's a lot going on. So this is about 6 minutes long.
Hi, Sheriff's Office.
Yeah, hi. Why don't you come on in here?
What's going on tonight?
Well, why don't you check out my forehead? You'll see exactly what's going on.
All right.
Jennifer!
Hey, whoa.
Jennifer!
Hey, whoa. Let's go and have a seat right here. Who's Jennifer?
Jennifer is my wife. My wife just happened to hit me in the head with an ashtray.
Okay,
What do you think?
I'm asking.
Well, look at this. Look, I've got to look at this.
Okay, take a look at it.
Jennifer.
Sir, what's your name?
My name's Matt.
Would you like a medical treatment?
No, I don't want any medical.
Okay, let's calm down. Talk to me. Tell me what's going on tonight.
Well, we were arguing over money about a dress or something like that. A little discussion. Got very heated, and then she just suddenly starts going off. She just starts, she's throwing stuff. I tried to calm her down, and she hit me with the ashtray.
She hit you with an ashtray. Where's that ashtray right now?
It's over there in the back.
Do you have any firearms in the house?
No, I don't have any
firearms. You don't have any firearms?
No.
Jennifer, could I ask you to step over here, please? Are you injured? Do you need any medical assistance?
No.
Can you tell me what happened in your own words? It's okay. Go ahead and tell me what happened.
We were arguing, and I hit him with an ashtray.
Okay. Did he hit you at any time?
No. Do you like it?
Where'd you get that? Is that new? Where'd that come from?
I got it on sale today. It's for Sally's party.
How much money did I just spend, huh? How much? How much money did that cost me? Tell me. How much?
It was marked down to $150.
$150. Oh, that's just great. $150. What do you think? I can't afford something like that. I can't afford anything like that. What are you, stupid? You think money just falls into my pockets? No. You didn't even ask me if you could buy the damn thing.
I saved up the money.
You saved up the money. It's my money. I make the money. You can't save up my money.
I'm sorry. I just wanted to look nice for the party.
Look nice, my ass. You look like a slut. Do you understand me? I told you before that you are not going to that party. I am going over to Dan's that night for the big game, okay? We're not getting a babysitter, so you have to stay home.
My sister can watch Molly if...
How many times have I told you? Your sister and your family is not to set foot in this house. Do you understand that?
Stop yelling. It's okay.
No, it's not okay. It's not okay. You're listening to what I'm saying. Do you understand? Is it going through your head?
No.
What are you talking about? It's the only way you can understand me. I'm trying to... Where are you going? Where are you going? Don't you dare walk away from me. Hey, listen. Your sister is not to set one foot in this house. Do you understand? You're not going to that party because I'm going over to Dan's that night. All right? Why would you wear a dress like that? Huh? What you got a boyfriend? Is that it? You got a boyfriend, don't you?
Maybe I do. Maybe I do.
Oh.
What are you doing? What are you doing? Don't
That's
do
it.
that. Please don't
That's
do
it.
that. Don't, Matt.
That's- Ah! 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 Ah!
So, the reason we wanted to show that is it actually, it's dated, but it does emphasize and shows how important it is to put that domestic violence incident that a law enforcement officer is walking into in the broader context of that relationship. And, if you could tell, I'm not sure if you could tell, this was really, the woman was in danger of being arrested for domestic violence. And so if you're a law enforcement officer on the scene, all you're going to see is that physical injury. And it just shows how nuanced they have to be. And it also shows a lot of different types of domestic violence really quickly. So he's talking about isolating her from her family, a lot of the financial stuff, financial controls happening. He's being degrading, the verbal abuse was there. And then, of course, the ring, taking the ring off, what does that mean to her? And how is she going to be able to convey that to the police? And that it indicated some type of extreme danger to her. So, that's the video. So just a little data. Let's see. So the New Orleans Police Department, they get about 40 domestic violence related calls per day. In 2015, they made 2,201 arrests for domestic violence related crimes. So we know that that's not actually accurate and doesn't show how bad the problem really is, because so many people, don't report every single incident of violence in their relationship. And this is crazy. In 2014, Louisiana ranked second in the number of females murdered by males in single victim, single offender homicides. So 73% of them were intimate partners with their murderers. And the CDC reports that health-related costs of domestic violence exceed $8.3 billion annually. So all of this is really just saying that in our work, we always try to keep in mind that domestic violence is a big issue. It affects everyone. It doesn't only affect women in heterosexual relationships. A lot of the, sort of historical background and examining the patterns of domestic violence is grounded in heterosexual relationships, but we know that domestic violence knows no bounds and can affect everyone. So, what's the blueprint? So the blueprint for safety is a policy and a process. So by a policy, it's a single philosophically based policy that coordinates the response of criminal justice agencies to DV, but it's also an ongoing interagency community assessment which examines how each system enhances or diminishes victim safety and offender accountability. It's based on 6 foundational principles. So I'll read them because they're pretty good. So an interagency approach in collective intervention goals, an attention to context and severity of abuse, acknowledging that domestic violence is a patterned crime requiring continuing engagement, ensuring sure and swift consequences for offenders, sending messages of help and accountability to our community, and reducing unintended consequences and disparity of impact. So, how did it get started here in New Orleans? So, when we think about how the blueprint came to New Orleans, you kind of have to put things in context. So, this is a quote from Mary Claire Landry. She really brought the blueprint here in a lot of ways. She's the director of the New Orleans Family Justice Center. So, she said, "While Hurricane Katrina was devastating to New Orleans, I also saw it as an incredible opportunity. Every single system was destroyed. Crescent House Shelter, which is a domestic violence shelter, burned to the ground. The police department, the district attorney's office, the courthouses, all were flooded. Every single agency in the city lost their ability to operate, and every single person in the city was in survival mode. If in a moment's notice your world as you know it was destroyed, recovering and rebuilding was the order of the day." So before the blueprint started, we kind of had a beginning of the coordinated community response to domestic violence. So the Family Justice Center opened in 2007. And in 2008, NOPD domestic violence detectives and prosecutors from the city attorney's office and the DA's office, they became co-located at the FJC. And in 2010 and 2011, with all of these different agencies kind of on top of each other and working together, they realized that there was a need for a policy for all the different criminal justice agencies to have a unified approach to domestic violence. So that was really called the integrated protocol. So I think that wasn't an easy process. It continues to be a challenge, all of those different agencies kind of working together. So some of these institutions can have opposing goals kind of when it comes to domestic violence criminal cases. And working together involves opening yourself up to scrutiny. So, for example, what a district attorney might want in a domestic violence case might be very different from what a victim advocate wants in a domestic violence case. So, we work on this all the time and we hit hiccups with it all the time, but we really try to engage in positive and transparent communication, and acknowledge where everybody is coming from. And it's just been essential for the blueprint. So those are some of the early initiatives. The city was really vulnerable and we needed outside help for our response to domestic violence. So the Family Justice Center looked for national leadership, and that's how they were connected with Praxis International, which is based in St. Paul, Minnesota, and that's where they created the original Blueprint for Safety. We're one of several blueprint cities. So it was originally housed in the Family Justice Center, but it was eventually transitioned to the city, mostly due to the mayor's commitment to addressing violence as a public health issue. And so it's been in the health department since 2013. So the reason it moved to the health department is because we already have a lot of ties in the community, and we're a very, very neutral place talking about that communication. We're not an advocacy group. We're not a criminal justice group either. So we can facilitate those difficult conversations. So where did our community begin? So we really started with community assessment, and I think at this point, I do want to acknowledge this is the part that Amy and I weren't working on the blueprint for. We actually were in the criminal justice field, so we knew about the blueprint and kind of helped, but all of this community assessment information, if you want more information about it, you can go to the Praxis website, and there were two people in particular, Katie Van Brick and Amalfi Parker Elder, who did a lot of this work, and it was very intense. So just want to acknowledge their contribution. So, but yeah, they had to assess our community's needs, and they needed to really test the assumptions, like who is not being served by our criminal justice agencies. So let's see. So this is a Praxis model for community assessment. So before you really talk about who and how things are done, you sum up what is done. So this just shows this interconnecting loop between posing questions, gathering information, searching for gaps, and then actually implementing a policy change. So first off, we really looked at how the practitioners are organized, and I think that's how Amy and I both came into contact initially with this. So we looked at all the different criminal justice practitioners, and we learned all about them. You know, how does your job work? What do you do every day? Who in the community do you work with regularly? And we also focused on, you know, the most important part of the blueprint, which is assessing risk and safety. So looking at all of those different criminal justice agencies and seeing how their policies and how their actions were affecting safety for individual victims. So this is a crazy slide, but so Praxis uses the story of one victim to show how many systems a victim has to interact with after, I'll say she, makes that initial 911 call. So after all these different colors are different actual systems that she's going to probably come into contact after reporting domestic violence. So she's going to have dozens of practitioners at different levels in different agencies working on her case. She's going to have an open case with all of them. So the community assessment was really a way of looking at how the response of any one of these systems enhances or diminishes safety and well-being of victims and their kids, and enhances or diminishes accountability and opportunities for change for offenders. So this is specific to domestic violence, but if you're thinking about doing community assessment for other stuff, another one you could do would be very similar, would be, you know, a woman is sexually assaulted at her college. So she's going to have several cases. She's going to have a police case. She's going to have, you know, probably a medical case if she gets a forensic exam. She'll have a case with the local district attorney, possibly a campus discipline case. So you can use this for other things. So when they kind of were assessing our city for the blueprint, they used all of these different community assessment methods. So they did mapping, focus groups with mostly victims, interviews with practitioners, they did observations, and then document analysis. So Praxis has done so much work on community assessment, so just go to their website if you want more info. So this is another crazy slide, and this is an actual map from one of the initial sessions they had with practitioners here in New Orleans. So you can see how complicated it is and how many different systems. This is just the beginning, you know, this stretched around a room on whiteboards. So shows just how complicated it was. So when assessing the community's readiness for the blueprint, we kept in mind some key concepts. So keeping a focus on the assessment trails, like how are these different systems interacting with each other. This is a big one, focusing on gaps between victims and institutions, not bad practitioners and bad actors. And always keeping in mind the survivor's voice and experience, keeping that at the forefront of our actions. So I'm going to turn it over to Amy. Oh yeah. Sorry.
Okay, here, everyone. So I'm going to talk a little bit about some of the major accomplishments the Blueprint has done since its launch. One of the first big accomplishments was incorporating risk questions into the electronic police reports. So each time an officer goes to a scene and makes an arrest, he must ask these 4 questions to determine the level of risk the offender poses to the victim. So the questions are, 1, do you think he or she will seriously injure or kill you or your children? What makes you think so, or what makes you think not? How frequently and seriously does he or she intimidate, threaten, assault you? Is it changing, getting worse, or getting better? Describe the time you were most frightened or injured by him or her. And have you been threatened for seeking help, particularly from law enforcement or the courts? So a real example of how this is helpful is that I knew an officer who went to a call. It was for a simple battery, and she just said that he slapped her across the face. So after he asked question 3, the officer found out that the offender had strangled the victim a few days prior. So without that risk question, the officer would not have known that and possibly thought that that offender posed a lesser risk than he actually did. So judges in prosecution use these risk questions in determining appropriate bail amounts. So they may give a higher bail for someone who has this written into the police report. Do you have a question? Blueprint policy, she asked, we had a question about if these questions were being asked on the scene or if the victim is being removed. It is written in blueprint policy that you're supposed to separate the victim and the offender, and you're supposed to do that before because you may not even know who the true victim and the true offender are, so they should not be together. Unfortunately, there's probably times where this doesn't happen, but that is in blueprint policy. As you all may know, NOPD is understaffed, so sometimes only 1 officer goes out to a scene, and it's really supposed to be 2 for a domestic call. That's a good question. Another accomplishment is we implemented a new incident sheet given to all victims in DV cases. So sometimes an arrest isn't made on scene. If the offender leaves the scene, they have to issue a warrant, or maybe there's not enough information to even issue a warrant. So, but those victims are still able to receive services at the Family Justice Center even if their arrest isn't made. So this is great because it allows victims to have these resources that they may not know about. And it just makes them probably feel like the officer is being empathetic toward them or recognizes them as a victim of violence. So another thing that I maintain every week is I keep a weekly log of DV calls with charges, offender and victim demographics, and whether or not the defendant was arrested or issued a warrant. So this pie chart includes the most common DV criminal charges from 2016. The most common charge is a simple battery, but this chart also includes things like disturbing the peace, strangulation, and aggravated assault. And lastly, well, not lastly, there's one more, but this, we have done a great job with increasing communication and collaboration between agencies. So, for example, probation and parole now receives the same record that I do weekly to check for current parole violations. Prior to the blueprint, DOC was relying on offenders to self-report that they had new charges, and many offenders probably don't admit to their probation officer that they got into a fight with their girlfriend again. So this is great. This helps victim safety. And then also multidisciplinary participation in monitoring activities so agencies understand each other's roles. Many agencies just work in a silo. They don't really know what each other does. And so this actually garners more respect between agencies, I think, because they really see the challenges between each other's jobs. So we also created a sentencing guide for judges. In 2014, there were new DV charges or new DV laws that increased penalties. And a lot of judges don't educate themselves on those new laws, unfortunately. So I made this sentencing chart for them to have at their bench, and this ensures that judges sentence offenders in accordance with the new laws. And, oh, I'm sorry. Yeah. We presented it to some of the judges, but not all of them were able to come. So
it was initiated by a judge.
who's like, we need
Yes.
help. You know,
Right.
this is too much.
Right. And I'm not an attorney, so I had to get a lot of revisions from a judge in CDC. But I think that eventually it'll be integrated into their policy. And then a DOC resource card for field agents to carry in reference when going out to DV parolees. So, some ongoing activities. In the fall, we had some 911 monitoring sessions. So 911 has their own blueprint policy. We created a team filled of NOPD officers, Family Justice Center advocates, and prosecution, as well as us, and we met 3 times. So the first session, we listened to 10 calls. They were randomly chosen. Each listener was given a review checklist based on our policy. Then the next session, we reviewed each call. And then the third session, we actually went to the 911 call center and talked to the director there about our findings. So there were some issues. They just collaborated 911 with EMS.
Yes.
So there's some growing pains with that. So we're going to follow up. I created a report, presented it to our mayor's meeting, and we're going to follow up in the next month or so and see what their progress has been, because it's been about 6 months, and hopefully all the new people are trained. So we will find out. And then we did a text analysis with NOPD in December, where we reviewed 4 police reports, and we uncovered a need for new training about the risk questions. Some of the officers have difficulty separating the risk questions. As you could see, they were kind of complicated. So we will begin training with the 7th District in spring 2017 about how to do those risk questions in a better way. So now we're going to talk a little bit about one of the underlying principles that we talked about was practices devotion to seeing if there are any disparate impacts on certain communities based on our policies. So I'll first describe what disparate impact is. It exists when the proportion of a specific group within the control of a criminal legal system is greater than its proportion in the general population, or when the criminal legal system intervention has a more negative impact on a specific group. So it's basically making a rule and it hurts one group more. So we don't want to do that. An unintended consequence refers to reforms to institutional policy and practice that are meant to increase safety and well-being for victims of battering that instead jeopardize safety and well-being and contribute to disparity of impact. So an example of this is NOPD has a mandatory arrest policy that they encourage. So when they arrive at a DV scene, so the policy was designed to increase accountability of offenders and send messages to offenders in community that DV is a serious crime. But what it did was led to higher arrest rates of women and increased dual arrests. And as you all know, New Orleans has a high incarceration rate, so we don't want to continue that. So other blueprint communities look at different communities. In St. Paul, for example, they look at the Native women, Native American women. In New Orleans, we look at African American women. So as you can see, these statistics, 60% of New Orleans population is African American. Domestic violence arrests are approximately 86% African American and 21% female, but 88% of women arrested are African American. So there's a huge disparate impact happening here. So why is this happening? So to find out why this is happening, we conducted some focus groups with African American women and engaged in more text analysis. So we learned from the focus groups that the women were often using self-defense strategies, including physical acts, but they did not describe their actions as self-defense. So a lot of women avoided a victim designation. They didn't want to call themselves a victim. And they spoke about conflict with their partners in terms of mutuality, which would not come across as self-defense to law enforcement. So if a law enforcement officer you don't identify yourself as a victim, he might identify you as an offender. So police aren't seeing these acts as self-defense. There are also just stereotypes of African American women that exist, and it can lead to just differences in system interaction. And also, so then we looked at we measured what the women said to what the police reports were actually writing, and we didn't see that the officers were doing any predominant aggressor assessments or self-defense assessments. So the stories of the women in the police reports weren't similar. So that means that in policy and training, we need to look at strengthening the police department's self-defense and predominant aggressor assessments. So that way they might be able to better determine who the actual aggressor is. And so we learned a couple things from the focus groups. One, credibility. The victims weren't feeling like the police believed them or found them to be credible. Two, trust. The women maybe not trust the police. Three, again, women didn't identify as victims. They would describe the incident as we were arguing or we were tussling or we, very much about we, not about him. Let's see. And some women report that they hit first just to get the abuse over with, kind of like that video showed. She was defending herself, but also I've heard women say that I struck him first just so he would just go ahead and beat me up and be done with it. And then also police contact as a last resort. So there are a lot of consequences when you call the police. Monetary, you might not have enough money for rent, you don't have anyone to watch your children. So it's a last resort to call the police most of the time. So that all leads to how important police empathy is. And so here is a quote from one of our survivors. So you try to get away from somebody. I used to wear long nails. Some kind of way I scratched him. I called the police on him. He had hit my head through a wall, and I went to jail for scratching him. So this is a real example of just how the lack of questioning leads to the wrong result. The police just looked at who had the visible injury. So we have a couple upcoming projects. We have applied for a grant to fund a legal advocate.